How does adaptive DBS affect cognitive function? Have you ever wondered how adaptive deep brain stimulation affects cognitive function in people with Parkinson's disease? Adaptive deep brain stimulation, or aDBS, is a cutting-edge treatment that adjusts stimulation based on real-time brain activity. This method specifically targets abnormal brain wave patterns linked to motor symptoms. Unlike traditional deep brain stimulation, which provides constant stimulation, aDBS dynamically modulates stimulation to better align with natural brain rhythms. Most research on aDBS has focused on its effects on motor symptoms, such as tremors and rigidity, rather than directly on cognitive outcomes. However, there are several important points to consider. First, aDBS targets areas of the brain involved in motor control, like the subthalamic nucleus. This area is primarily responsible for motor functions, so the main benefits observed are improvements in movement-related symptoms. By adjusting stimulation based on brain activity, aDBS may reduce unnecessary stimulation, which could help minimize side effects that might affect cognitive function. Traditional deep brain stimulation can sometimes lead to cognitive side effects, including difficulties with speech and executive function. These issues may arise because continuous stimulation can affect nearby brain regions. Since delivers stimulation only when necessary, it may help avoid these adverse effects, potentially preserving or even improving cognitive function indirectly. Another advantage of aDBS is its energy efficiency. Studies show that aDBS can save about 40% of battery energy compared to continuous stimulation. This reduction means fewer surgical interventions for battery replacements and less overall exposure to stimulation. While this targeted approach is primarily aimed at improving motor symptoms, it could also contribute to better overall neurological health, including cognitive aspects. However, more research is needed to confirm any direct cognitive benefits. Currently, most studies on aDBS have been short-term and focused on motor outcomes, leaving gaps in our understanding of long-term cognitive effects. Larger, longer-term clinical trials are underway to determine if aDBS can effectively reduce motor symptoms without causing cognitive decline. These studies will also explore whether aDBS might improve cognitive outcomes compared to traditional deep brain stimulation. From a clinical perspective, aDBS represents a promising advancement in managing Parkinson's disease. It may enhance the quality of life by optimizing symptom control while potentially reducing cognitive side effects. However, it is essential for patients to receive personalized medical advice, as cognitive effects can vary based on individual brain anatomy, disease progression, and stimulation parameters. In summary, adaptive deep brain stimulation primarily enhances motor symptoms by adjusting stimulation in response to brain activity. It may also reduce cognitive side effects compared to traditional deep brain stimulation by limiting unnecessary stimulation. While definitive conclusions about its direct impact on cognitive function are still pending, current evidence suggests that aDBS could help preserve cognitive function by minimizing overstimulation and related side effects.